Hello viewers, welcome back to my channel. In today's video, we are diving into the SDTM Vital Signs domain, which is one of the most frequently used domain in clinical trials. We will go step by step covering the key variables in the vitals domain, the difference between the vital signs and the physical examination, the important distinction between the LOBXFL, which is the last observation before exposure flag, and the baseline flag. And finally, we will look at an example dataset along with the annotated CRF page for vital signs. So let's get started. VS domain is one of the domains from the finding class of SDTM. VS domain contains measurement including but not limited to the blood pressure, temperature, respiration, body mass index, that is the BMI, height and weight. The structure of this domain is one record per vital signs measurement per time point, per visit, per subject. The topic variable for this domain is VS test CD. Now taking an example of this image, you can see that the subject is getting its blood pressure being monitored here. And since we know that for blood pressure, there are two readings. One is the systolic blood pressure measurement and the other is the diastolic blood pressure measurement. So from this, if we want to see what type of data is captured and how we can map into the SDTM VS domain, we can say that the VS test CD will be populated as the systolic blood pressure for one record and one for the diastolic blood pressure, because we will have two readings when we are measuring the blood pressure. The next is the position. Since in this image we can see the subject is sitting, so the VS position can be populated as sitting. In case the subject would have been standing or lying down, then the position will have been standing or supine. Similarly, we know that the blood pressure is being measured on the arm. The VS location is arm, and which arm is going to be populated in the VS lat variable. And in this image, since it is the left arm, we have populated the VS lat is equal to left. Now comes the most important thing, that is the result of the test being conducted. So in this case, whatever value of the blood pressure we are going to capture, that will go as the collected result, that is the VSORRES, and the collected result unit, that the in this case the blood pressure unit, which will be mmHg, the VSORRES U is going to be populated. So in this example, we know that the captured result is populated as the ORRES variable and the ORRES unit variables in this case. But in case, for example, when the subject height or weight is measured, and if those measurements are not done in the standard unit, the standard unit for height is centimeters, and for weight it is kg. If in case these standard units are not used for these measurement, and these measurement are done in conventional unit, then in that case the captured result will still go in our VSORRES and VSORRES variables, where the ORRES-U will capture the conventional unit, but we will have to convert these result values to the standard values. So in that case, applying the convention formula, that is the when you want to convert the conventional unit result to the standard unit, you will populate the VS stress C and stress N variable with the result which is in the standard format, and the standard unit will go in the VS stress U variable in this case. So the VS stress C, stress N, and stress U are the variables which are capturing the result in the standard units, whereas the VS ORRES and ORRES-U are the variables which are having the value of the result kept as collected. Vital signs measurement is in clinical trials is done to ensure the subject safety, monitor treatment effects, and detect adverse event reactions early and provide regulatory compliant data for analysis. Vital signs testing is a core part of safety measurement in clinical trials. Compared to other safety assessments such as the lab, ECG, or QS assessments, VS give quick, objective, and repeatable information about a subject's overall health and how the investigational drug or treatment might be impacting them. Also note that the VS tests which are done is non-invasive and where as compared to the other safety assessments. Now let's discuss the difference between the VS baseline flag and the VS last observation before exposure flag, that is the LOBXFL variable. This variable was added to the SDTM in the 3.3 version of the SDTM IG. If we talk about the definition of these variables, we know that the LOBXFL is defined as the last non-missing value prior to RFX STDTC. So one might say that this is the definition which is also used for the BLFL. So how these two variables are different. The difference between these two variables is that the definition which is the LOBLXFL gives that it is the last non-missing value for prior to RFX STDTC, that is prior to the first dose of the study treatment, and this definition is fixed, which means that there will be no change in this variable derivation and it will always be the last non-missing value prior to the RFX STDTC, whereas the BLFL is sponsor defined. So when we say sponsor defined, what that means is that in some studies, sponsor may define baseline differently. For example, for some study, they can define the baseline as the first measurement collecting during the screening or the baseline period, or they can also say that we want the baseline records to be flagged as the average of multiple pre-dose assessment. Sometimes they take the screening visit record as the baseline value, and even sometimes they can ask to add other variables into consideration, such as the position variables, the method variables, etc., to while the deriving the baseline flag. So in this case, you can see that the definition of baseline flag is very much sponsor dependent and they can modify as per their requirement. However, the LOBXFL definition is fixed and it will always be the records which is flagged for this variable will be always be the record that is the last non-missing value prior to the RFXDTC or the last dose prior to the treatment study drug being taken. So while VSLOB XFL is always consistent, the baseline flag, which is the BLFL flag, can change based on sponsor rules, protocol, or SAP. Right now, I'm showing you the CRF form, that is the annotated CRF from one of the studies for the vital signs. In this form, we can see that the vital signs form have questions related to whether the vital signs was collected with a response of yes or no. If the vital signs was collected, then we will have the information which is the visit, date, and the respective vital signs parameters, which are the temperature, pulse, and the BP, systolic and diastolic blood pressure is being measured. But in case the vital signs was not collected, then we will select the response as no for this particular question. And in this case, when the vital signs is not collected, we will still create a record that will say that the VS test CD will be the all VS test, VS all, which means all the vital signs which are being collected in these studies was not done for this particular visit, and we will have the VS stat populated as not done. But in case when the vital signs is collected, we will populate the visit from the visit form of this questionnaire. The date will have the information of VSTTC, and we have the temperature parameter for vital signs being populated where the VS test CD will be temp and the collected result will go in the VS ORRES, and for the temperature test we have the VS ORRESU as the Fahrenheit. Similarly, you can see that for the pulse and the systolic diastolic blood pressure, we have another information apart from the measurement being populated as the position, which is that the first measurement is done in the supine position. So from the VS vital signs CRF form in this case, you can see that although there is not a separate question which is capturing the answer of whether what was the position, but the way the CRF form is designed, you can see that the information which is captured in this form is having the VS position as supine. So for the first measurement of pulse, systolic blood pressure, diastolic blood pressure, the position will be populated as supine. So in this way, you can see that the variables which we have discussed earlier can be annotated in the CRF form, and from there we can know how the VS is being captured for each visit. Before we go to the difference between the vital signs and physical examination, let's see one of the examples for how the data is captured and shown in the SDTM vital signs domain. Right now, I'm showing you the data for one subject for two visits, that is the baseline and the visit 2. In this example, you can see that for row number 1 to 4 and 6 and 7, we are having multiple records populated for the same measurements, and we have the VSTPT and the VSTPT num being populated. This is because we have multiple baseline measurements being taken for these subjects in these visits. The second which I want to show here is the record number 2, 4, 5, 7, 8, 9. You can see that for these records, the VSLOBXFL is populated as Y, which indicates that these observations are used as the last observation before exposure measurement. Another case which I want to show here is the record number 12, where the temperature was collected, but it was collected in Fahrenheit unit. So the collected result and the corrected unit was populated as Fahrenheit with the result value of 97.16. But since we want to have the temperature in our standard unit, we have to convert the temperature to degree Celsius unit. So in this case, you can see that the VS stress C and stress N, which is the corrector and the numeric result, populated for degree Celsius conversion, which is the unit is captured as the VS stress U here, and we have the after the conversion, we can see that the 97.16 Fahrenheit is converted to 36.2 degrees Celsius here. The last record here is the record for the weight measurement, and this record was not done. So we can see that the VS stat is being populated as not done in this scenario, and the reason this assessment was not done is being captured in the VS recent variable with the value as subject refused. When we talk about the vital signs and the physical examination in clinical trials, they may sound similar, but they are actually quite different. The vital signs are like the basic measurement of life. They include things such as your blood pressure, heart rate, temperature, breathing rate, or the oxygen level. These are quick numeric values that can be checked by a nurse or a technician using simple devices. Think of them as the dashboard indicators of your body. Just like speed, fuel, and temperature gauges in the car. They give us a snapshot of how the body is functioning at that exact moment. However, whereas the physical examination is like a full service check done by a doctor. Here the physician look at you more broadly, checking your skin, ears, chest, lungs, heart, abdomen, and even your nerves and muscles. Instead of just number, these involves observations and judgment. For example, the doctor may note things like no swelling, heart sounds normal, or mild rash observed. So in simple terms, vital signs tells us the basic number of life, whereas the physical exam tell us all the overall condition of the body. They go hand in hand. If vital signs are the warning lights in a car dashboard, then the physical exam is the mechanical lifting the hood and checking all the parts. That's all for today. If you find this video helpful, don't forget to like, share, and subscribe for more SDTM, ADAM, and SAS programming tutorials. Let me know in comments if you want me to cover any specific topic. Thanks for watching.